This talk is about tandem, cervical, and lumbar disc replacements. My name is Dr. Pablo Pazmino. I can be found online at spinecal.com. These are some of the hospitals where I'm on medical staff. What we've been seeing lately is that patients are now traveling from the South, from the Midwest, and even internationally to have us perform their procedure here at the Spinecal Institute. Let's talk for a moment about why you would even need this surgery in the first place. With a herniated disc, you can see in the figure how the disc squirts out and impinges the nerve root. This shoots pain down your arms, down your legs, causes neck pain or back pain. After listening to some of these symptoms, is this starting to sound familiar? Let's go ahead and listen to someone who's had the surgery already and what he presented with beforehand.
Therapy, chiropractic. Found no relief. Had constant buzzing, tingling, numbness, muscle weakness, burning pain in both of my arms and legs all the way to my fingers and toes. Constant neck and back pain.
Now let's take a glimpse at what I see during the actual procedure. The cervical spine, typically when we get in there, we see that the two bones are resting on top of each other in a bone-and-bone appearance. This is what it looks like in real life, anatomically. In order to take the disc herniation out, we use these grasping type instruments to help pluck the disc off your spinal cord and off your nerves. And this is what the finished product looks like with the space. For that same view in the lumbar spine, you can see here we actually have to mobilize the vessels. In order to mobilize the vessels, I do the surgery in conjunction with a vascular surgeon. Once the vessels are mobilized, we insert the disc replacement. This is what the retractor looks like after the vessels are mobilized, and this is a view from the skin. If you look inside, this is how we look at the actual disc, ready to be replaced. Now, let's look at the actual instrumentation of the artificial disc itself. Now, the Pro Disc was actually invented in the 1980s. Here's some actual photographs from the patent itself. It was approved by the FDA in the United States for use in 2006. This is a general view of the actual Pro Disc from some different angles, which we'll take a look at now. The Pro Disc allows for preservation of mobility in rotation and flexion extension. The ball and socket design, which is a concept similar to the hip and shoulder replacements, and it allows for secure fixation within the spine. Now, there are two ways it actually secures fixation. The first is this central keel mechanism. This reminds me of a shark fin. If you look at the implant, there's a fin on top and underneath, and that provides immediate fixation to the spine. The next method of fixation is the porous coating on the end plates themselves. Now, this porous coating is a concept similar to what we use in hip and knee replacements. If you look at the arrow on the red, when the implant is first placed against metal pores, the bone lies right in line. But with time, like the arrows in yellow and blue show you, the pores start accepting the bone as the bone grows into the end plates. In terms of the disc replacement, why choose Spinecal? Why choose me to be your spine surgeon? I think what you'll find is I take a passion into disc arthroplasty. I understand its beginnings, my orthopedic background gives me an understanding of how exactly it works, but we also do things differently. We listen to our patients, we take our time with patients, and for me, I love explaining the pathology to our patients. What's unique about the Spinecal patients is they all understand how to read their MRI, they all understand why they have the symptoms, and by the time surgery comes, they understand what they're having done.
First I finally picked it up, I was able to start looking out for more qualified experts. Found Dr. Pazmino, met with him. His patient manner was bar none to anybody else I had ever encountered. All the doctors before had either no explanation or really no interest in providing help, and just were quick to move me on or throw a bunch of pills at me. Dr. Pazmino was, like I said, just top notch, knew exactly what was wrong, was able to pinpoint everything, which corresponded with the research I had done. Recommended pro disc replacement surgery for the two levels that were the worst in damage, the C4-5 and the L4-5.
Now, he ended up having artificial disc replacements of his neck and back. So in his own words, let's hear how he's doing after having had the surgery.
Recommended pro disc replacement surgery for the two levels that were the worst in damage, the C4-5 and the L4-5. July of 2011, we went ahead and did that at Cedars. Great experience. The minute I woke up from the surgery, all the leg and the arm issues were gone. I had no more pain, no more numbness, no more tingling. Initially, I'm still recovering. Recovery was not terrible, but moving right along. I'm back to work now. I've got more activity. I don't have my weakness in the muscle drop that I had in my legs. No more stumbling, anything like that. In the neck, still have actually regained range of motion that I didn't have prior to the surgery.
That's great. Let's see your lumbar range of motion.
And
excellent. I'm just going to zoom in here on your incision here on your neck. And that's your neck incision. And then let's see the devices, the disc replacements.
again, it's Pro Disc artificial disc. That would be the cervical, which was implanted at the C4-5, and the lumbar at the L4-5.
Excellent. Okay, great. Thank you. Thank you for watching this video on the Tandem lumbar and cervical arthroplasties. Because of demand, we've had to expand to 3 offices to serve the entire Southern California basin. Here's our main hub in Santa Monica. We're also seeing patients in Glendale. And here's the office phone number to schedule a meeting there. And finally, here's our office address and phone number in Long Beach. If you or someone you know could benefit from a lumbar or cervical disc replacement, here's our contact information. Here's our website, a direct line, a 1-800 number, or a direct contact email. Thanks for your time.